Liver. What are the diseases you know of the liver? Common conditions. Yeah. Write down in the chat. What are the common conditions about liver you know? Anyone else? Cirrhosis. Fatty liver is cirrhosis. Now, cirrhosis can be two types. One is alcoholic and another is non-alcoholic. So what is happening? Liver, the tissue that gets deposited with fats and gets replaced with fatty tissue. That is cirrhosis of liver. It will happen if there is alcohol because it is going to be inflammatory to the liver. And it is going to happen because of certain conditions. Yeah. Now, these conditions are genetic, hereditary, something, sometimes viral infection. So which virus affects liver? Hepatitis. Yeah. Hepatitis A, B, C, and E. So A is through dirty water actually. Hepatitis A is because of contaminated water. Hepatitis B is through blood to blood contact, blood to blood transmission. Hepatitis C is again blood to blood. Okay. So when you go for a blood donation, they do three important tests. They do more, but this hepatitis B, C, and HIV. So all three are transmitted with the same route. Now, hepatitis C is known to cause liver cancer. So if there is an interesting question, which cancer is vaccine preventable? So liver cancer, because hepatitis C, there is a vaccine for that. Right? All doctors, almost all of us take it. Yeah. If you deal with needles or something like that, or emergency care provider or a doctor, you should do that. Take it. Now coming back to the cirrhosis part, the fatty liver part. So what is it? In a simple term, it is inflammation of liver tissue. The liver tissue is getting damaged. It is getting deposited with some fatty fats. Adipose tissue getting replaced with fatty tissue. Now, what is the meaning of this? What you are doing is you are eating some inflammatory products. You are reducing some protective products. Correct? Before we start this, what are the functions of liver? Write down in the chat. Whatever is your understanding, even if wrong answer, it's okay. Whatever is your answer, even if it is wrong answer, write down in the chat. Detoxification of blood. Okay. Good answer. Now, digestion. Some hormones, enzymes, it will secrete. Yeah. Production of bile. Conversion of glucose to glycogen. Storage of glycogen. Yeah. Now understand. You eat food, that food goes to the stomach, it goes to the small intestine. When it reaches the small intestine, it stimulates your gallbladder, bile is secreted. It helps for digestion. There are some more enzymes which liver will secrete. This bile, this gallbladder is a storage mechanism, but secreted by liver. This bile is rich in cholesterol. What is the meaning of this? And this cholesterol is going to get excreted. So if you take some medicine or some food that releases more of bile in your stools, ideally your cholesterol should lower. So answer is yes. Okay. That is a correct mechanism of lowering your cholesterol natural way. If you don't want some allopathy medicines. Some food which stimulates gallbladder and bile goes to intestine. Another function is conversion of glucose to glycogen. Liver is the topic for today. It helps in, by secreting certain enzymes, it helps in absorption of certain things. Majorly it acts as a storage house, okay, for glycogen, for certain vitamins, for some minerals. Where is our storage house? So liver is the storage house. Yeah. Now, whatever function liver is doing, so it has certain cycles. We don't need to remember that. Even doctors also, we mug it up during second year biochemistry, but subsequently there is limited use. Okay. So as a nutrition dietary practice, you don't need to remember how the cycle flows, Krebs cycle, electron and all. That's a useless thing you should know. You will, over the course of your life, the liver will age, liver will degenerate, but it has a reproductive mechanism. So sometimes some people say, I'm alcoholic, but I'm not getting fatty liver. Yeah, you are getting some damage, but that is getting replenished. Yeah, that is getting restored back because you are probably some minerals, some supplements you are taking proper. Yeah, your nutrition is good. So fatty liver happens in people, those who ignore their diet for alcohol, especially those who drink beer. So beer has empty calories. When you drink beer, you feel full in your stomach, you feel full in your terms of calories here. And then you eat less. So those people who are beer addicted, so they have fatty liver more chances. Whiskey, rum, vodka, they also cause fatty liver. If your supplements, the protective food is less. If you are still taking protective food, okay, whatever 1%, 2% damage is happening, that is getting restored. So liver is one of the rare organ which can regenerate. When you do liver transplant, so in addition to all those match, you do the size match also. Yeah. And you take certain portion from this donor and transplant to the recipient. So from this donor, this remaining part of the liver will regrow. Good idea? So liver is a such organ which can regrow. It means it has such a regenerative power. If someone has fatty liver, it means they have done a lot of things to damage their body. They have gone to the so much extent, they hate themselves so much that they have damaged their liver. You understand? They are not taking care of themselves. Now coming to the final topic. Inflammatory items, inflammatory food which damage liver, non-inflammatory and protective. Okay. So for the simplification, we non-inflammatory will be the other food items which are, so we focus on inflammatory for today's discussion and protective food. Okay. Non-inflammatory we focus when we are talking of intestine because intestine is such a delicate. Sometimes from non-inflammatory also you are allergic. So that's why you have to take care. But in liver, that trouble is not there. It's such a strong organ. Yeah. Right? In Hindi movies, they say kaleja hai to either, jigar hai to either, right? So that kaleja is the liver. So it's such a strong organ. Now, inflammatory versus uh, protective food, anti-inflammatory for liver we are talking. Fatty liver can also be caused of because of certain hereditary or genetic conditions or metabolic conditions, but these are rare. Yeah, so you will not get those clients. Those clients will be managed by a gastroenterologist. You don't worry about that. Now, the maximum stress on any organ, always remember this funda. Whenever any inflammation is happening or the tissue is getting damaged, it happens because of free oxygen radicals, free oxidative radicals, the oxidative stress we call, right? You don't need to remember which free radical and all those things. Yeah, you should remember which is the source of this free radical. The common source of free radical, the fastest way I tell you, is reused, rewarmed oil, fried oil. You go to a restaurant, they fry their samosas, the oil decreases, they replenish it. So, but the remaining part, yeah, that is already oxidized. So when they further fry your samosa, you get stomach ache, you feel ill. If you are eating daily samosas, then liver will show something. Yeah, you may have jaundice. It's not because of maida, it's not because of samosa. It happened because of the oil. right? Now, it's a good point we should talk here. What are the symptoms when the liver is damaged? Okay. It takes a lot of time for the symptoms to appear because liver is a big organ and it is regenerating. Okay, it takes a lot of time. The first symptom will be like uh, this white of the eye will be little bit yellow. Okay, you have to see it in a natural light or a white torch light. And then next will be the yellow coloration of the urine. And the third will be yellow coloration of the skin. So don't wait for yellow color of the skin to happen. Yeah, if you suspect it is a yellow eye, you should visit a doctor, get your test done. Yeah, it's better to get it tested. What you need to do, you need to do LFT, liver function test. So what will LFT include? We will take it today. Yeah, we have done it in this in the class for lab reports, but still we will do it now. I will share this file with you right away. From the lab report in lipid profile, yeah. So LFT, liver function test. So you see cholesterol, triglycerides, HDL and LDL, because these are the things which liver will produce. Okay. Then you see, you go to the LFT part, liver function test, which will include bilirubin, protein and albumin, right? So this protein is also albumin or globulin. Yeah. Name of these are the two proteins. Yeah. Albumin is one protein, globulin is second protein. So we call total protein. These proteins are also secreted by liver. So if you are high or if you are low, you understand there is some problem, either with the kidney or the liver. This bilirubin is the fastest and the easiest method. Yeah. So you know whether you have jaundice. So if someone has jaundice, it will mean bilirubin is raised. There are some tests. You can see this one, SGOT, SGPT, and GGT, alkaline phosphatase and GGT. You don't need to worry what is this name, what is the meaning of this, which cycle it came from, how it came from. Just remember, if your result shows something in bold or red color outside this reference value, it means there is some problem in this. So when the liver is damaged, this will increase because these are stored inside the liver tissue, inside the liver cell. So when the liver is damaged, this cell will break. When the cell will break, its enzymes will be released. You understand? The marker. So this product, SGOT, SGPT, alkaline phosphatase, GGT, is supposed to be inside the liver, small cells. When the cells will break, something will get released. And that's how you know that there is a problem with the liver. As a nutritionist and dietitian, you should know this much. Bilirubin high, jaundice, albumin globulin high or low, some problem with the liver or the kidney. SGOT, SGPT, alkaline phosphatase, GGT, straightway problem with the liver. Okay, that's what you need to know. Coming to the okay, when you're doing this test, now you want to know the cause also. So if patient has some problem with the this gallbladder, they will have their symptoms, pain and all those things, yeah, and burping and all those things. But other than that, if it's silent, then you also want to do hepatitis A, hepatitis B, and hepatitis C to rule out the cause, because that is one of the most common cause of affecting the liver. Then you will do sonography. to identify what is the extent of liver damage. On sonography, you can pick up whether there is a fatty liver or the liver tissue is normal. A normal liver tissue on sonography will look like white dots in the background. In the fatty, it will look like white patches. Okay? So echo will change. The texture will change. Now there are certain foods which are inflammatory for the liver itself. Maybe other organs also, but today we are focusing on liver. So processed sugary foods, okay. Whenever you are eating something, you should check that some of the products, some food have sucralose or high fructose corn syrup. That's very harmful. You know, there is some packed cookies or packed small cakes without taking the name of the brand. You check this content. Any cookie, any cake you are eating, always check the content. If it has sucralose, high fructose corn syrup, harmful for the liver as well as the intestine. Maida or the white bread, pasta, they have been told to have bad effect on the liver. But assuming someone is completely dependent on maida, it's like probably someone who is Italian just eating pizza and pasta, or an Indian eating that. Alcohol, and don't get fooled by the hype that alcohol protects you, you should drink wine. Okay, so remember that anything, any medicine, any product you take, it has a beneficial effect, it has a side effect. The side effect of alcohol are much more as compared to the beneficial effect. And for the beneficial effect, you need to restrict your dose, 60 ml, 90. And that is a wine, not your whiskey, vodka, or other things. Yeah. And people are not able to stop at 60 ml of wine, 90 ml of wine. They will finish the whole bottle or a half bottle. Yeah. Those who drink wine, they know it. And if you don't drink wine, then don't start wine for two reasons. Number one, taste is hideous. Yeah. If you're not a wine drinker, you will hate that taste. And number two, the protective effect is not as much as you're paying for it. 1600 rupees low cost wine versus something else you can buy in 1600 rupees for the whole month. Yeah, you can buy dry fruits, you can buy lettuce, or you can buy some more protective foods, which we'll share in today's list. Yeah. Saturated fats. Now, among the saturated fats, so today the topic may not be on the lipid profile, but saturated fats also damage the liver. We are talking of fatty liver, the cirrhosis liver. Yeah. So remember, there is the fat itself will affect it. Among the fat, the saturated fats will affect strongest. Among the oils, the saturated oil will affect strongest. Yeah. If you are like a if your consumption for bacon's sausage is high, that also puts oxidative stress and fat stress on your liver. Now, the most damaging one of the oil is hydrogenated oil. Yeah. Nowadays, you may see that some fancy ads come, hydrogenated oil, like something that is a hype. Hey, stupid, hydrogenated oil is the harmful oil, and that you do it to save your cost. Yeah. So don't fall for that. How do you know whether your oil is hydrogenated or not? You keep it in the cold or the freeze. Yeah. The lower part of the freeze. And if it freezes some part, it has hydrogenation. Indian government has a mandate that if it is hydrogenated, it should maintain hydrogenated because it is so harmful. Yeah. There is something called palm olive. No, palm oil. Yeah, sorry, not palm oil. So palm oil, and which most of the restaurants will use because it is a low cost substitute. Yeah, low cost thing. So that's very harmful. What they do is they take the oil and they will pump the hydrogen, obviously with something else, catalyst, and this hydrogen, whatever is unsaturated part of this molecule, this hydrogen will go there and bond there. So that will become saturated. So hydrogen oil is the most saturated oil. So you want unsaturated oil, right? I should not be mentioning French fries, fried burgers, chicken burgers, pizza, and all those things, fried chicken, because that gives you happiness. Yeah. You want to eat it at least once a week. once a month. It's absolutely okay. Don't be afraid of getting your fatty liver or this thing because of that, even if the list mentions it. You should be afraid of the weight loss and all those things if you're not married. After the marriage, it really doesn't matter what you eat. Yeah. And you can use this tactic that whenever you go to some mall, you make your spouse eat more and you eat less. Salty foods, high sodium food, and artificial additives. Okay. So French fries, snack items, chips, all those, yeah, which are very high in content. Canned food, seafood which is canned, all those very high in salt. Uh, per se, it should not directly affect your liver, right? Yeah. If you are eating your French fries once or twice a month, thrice a month, or maybe once or twice a week, absolutely okay. So don't worry about the fatty liver part because of this. Many of the products, when you see the packed products, they have the artificial um artificial coloring agents, artificial sweeteners. That anywhere where you see artificial sweetener, that is very damaging to your liver as well as intestine. When you see artificial flavors, you know, so there is some chemical which has the similar flavor, which or whatever you like. You understand? Why you should need that? And that is very harmful for you. Now coming to the food which are protective for the liver. Before that, Visma has a question. Coconut oil is hydrogenated and harmful. So coconut oil is not hydrogenated. Okay. It is less unsaturated. What is the difference? Hydrogenated means artificially we have done something. There is oil you have taken and hydrogen added to the molecule chain, and that's why it became saturated. That is hydrogenated. In nature, there are certain oil which are more unsaturated or less unsaturated. There is a scale, more unsaturated, less unsaturated, right? On this scale, coconut will be lower. Then comes your groundnut, soya bean, sunflower, rice, all those, right? So the objective is to move towards unsaturated oils. Ghee is extremely saturated, huh? So worse than coconut oil is the ghee, clarified butter, cheese. Now, is most is whatever food items you think that are protective for liver, write down in the chat. Whatever you think. Easiest answer: the fruits and the vegetables. Yeah, and it's true. Yeah. Now in vegetables, green leafy vegetables, other vegetables, all vegetables, everything is good. Okay. Now obviously you will take care some vegetables which you are not suitable for your intestine. Maybe brinjal or capsicum or some seeds or something like that. Yeah. Otherwise, all fruits and vegetables, especially green leafy vegetables, then broccoli, cauliflower, cabbage. Among the fruits, all the fruits, but the berries, citrus fruits, these are like, whenever there is a citrus fruit, whenever there is a leafy vegetable, whenever there is a berries, they have antioxidant properties. Yeah, they have some antioxidant content. And that's why they are protective actually for everything, all of your body. Yeah. Now, fish, those who can eat fish. So they are rich in omega-3 fatty acids. If you cannot eat fish, then you have the ready-made fish oil capsules. Yeah. That's protect you for overall health, the skin, the bones, the liver, everything. Yeah, that's good. Now among the nuts, all these walnuts, almonds, flax seeds, chia seeds, they help protect from liver damage. Walnuts are high in omega-3 fatty acids and glutathione, which support detoxification. And flax seeds and chia, they provide omega-3 and fiber. Yeah. So anything that supports the fiber, that is going to be protective for the liver. One of the reason is when you eat more fiber, more bile is attached to it. Yeah. So what will happen is some of the bile will get some of the some components from the bile will get reabsorbed and go to the liver back again. But when you are eating fiber, this bile is secreted is and thrown out with the stools. Yeah. So is there anything else other than the fiber, the vegetables? So is there any other product other than allopathy, yeah, that increases your bile secretion and excretion in the stools? So answer is Arjun Ras. So you in Ayurveda there is a tablet. I'm an allopathy doctor, but this product in Ayurveda is awesome. Tablet name is Arjun Ras. You can find it in Dabur as well as Himalaya. I personally like Dabur. Both are good. So if you take that one or two every day, check your cholesterol now, check your cholesterol after 3 months, 6 months, it will decrease because it is doing the best part the natural way. Your bile excretion is increased, secretion is increased, right? If you don't want that, then the fiber is the best part. And some people are like, for fibers, you should eat flaxseed and chia seeds. Hey, I don't know what is flaxseed and chia seed. Hey, come on here. I cannot buy. I don't like the taste. What is your thali? Don't forget the patient's thali. What is your thali? Your thali is salad. What salad you like? Carrot, cucumber, potato, no, tomato, cabbage, yeah, radish. So whatever it is, you can take 3 of it in each meal. Rama is asking a question about Leaf 52 tablet. So it is Ayurvedic component, Ayurvedic tablet, which protects livers, and it has some herbs in it. You can take it if you wish, but if you don't have a damaged liver, you don't need it. Okay, and eating some medicines which you don't need is not a good idea. Now, when we talk of whole grains, some people just stick to oats, barley, whole grain. Hey, madam, rice is a whole grain, wheat is a whole grain, legumes is a whole grain. Yeah. So you say oats, eat oats. Ma'am, I don't have money to eat oats. So yeah, I don't have money to eat oats with milk. Yeah. No problem. Put oats in water and yeah. But you have to buy oats. That's the most important part. You cannot afford milk. So don't do that. Yeah. Some oats I personally don't like. Some people like, do it. No problem. Yeah. And same is for barley and all. Yeah. Some people like, some people don't. So always remember what is the thali of the client. Viral hepatitis, you should get blood test. There is a question that her client has a viral hepatitis. So this client will get her boyfriend or husband tested for hepatitis and herself also tested for hepatitis B and C. If it is C, then postpone or cancel the marriage, and also check for HIV then and other diseases. Yeah, there may be likelihood. Then if it is B you are having, then because C has a high risk of cirrhosis, cancer, long-term diseases, and it more likely cause maybe STD. If it is B, then there is a recovery, good hope for recovery, good chance, good prognosis. And you should take more sweets, more sugar food. Don't worry about getting fat before marriage. Before marriage, healing your liver and jaundice is more important. So take a lot of sugar, sweets, sugarcane juice, whatever sweets you can have. Reduce your fat consumption. In terms of the medicines, you can always take Leave 52 Ayurveda medicine. Allopathy, there is no medicine for this. Antiviral tablets you should not take for hepatitis B, not required, not recommended by WHO also, because the side effects are much more. Yeah, for hepatitis C, your doctor will decide. If it is hepatitis A, the best part, it will get this virus, your body will get it in next few weeks. During this time, you need to take care not to infect your family members. So you need to wash your hands properly before touching anything in the kitchen. And what if you had a contamination? You need to identify what is the contamination source, the water, and that has caused you hepatitis A. For any hepatitis, any jaundice, any liver damage, the formula is same. Sugar, high sweet food, sweet fruits, sugarcane juice, protective foods, vegetables, salad. You will not like it because you are already, taste and nausea is going on. But that's what you need to do as a medicine. And this harmful thing you need to reduce. Harmful will be the fried items and fat and oils you need to reduce. Few weeks you will need to do. There is a lot of research recently, and some US corporates, they tried to patent this thing related to turmeric. Yeah, turmeric is our product. It's Indian product. It's Indian medicine. So turmeric is extremely protective, and that's why Indians, they have less fatty liver. Yeah. So the meaning is not that okay, turmeric 1 spoon and alcohol 1 bottle. No. Yeah. So because the problem is not that it is counteracting. The problem is that there are more side effects of alcohol. Okay, here, and that side effect is much more. Yeah, and that reflects first. Okay, how many of you consume turmeric every day since your childhood, since 7 months? So everyone is doing it. Everyone is eating it in their food item. Yeah. And obviously the plain turmeric you are not going to eat. Yeah, that was expression. It's so bitter in taste. So if you need to drink turmeric as some kind of a juice or some product, then heat your water in the tawa, right? Boil it, put 1 spoon turmeric and continue boiling it till the time the water decreases 50% and the color changes from yellow to red. And then put little bit of salt. Yeah. And when you drink it, so it relieves your infections, because turmeric itself is a good antioxidant and everything. It reduces stress and it improves your health for liver, intestine, for your everything, every organ. It is good. Howsoever you like, Mira, my dear. Yeah, how much turmeric you like? So that's a good question actually. So I will tell you one story. One time I was cooking khichdi. I called my mother and asked like, "Mummy, मैं खिचड़ी बना रहा हूँ. I'm cooking khichdi. So how much rice and how much this thing?" So she said, I told her that I'm using this one bowl, one cutlery, 1 bowl of rice and 1 bowl of dal. She was like, you are alone, right? How can you eat that? And then few months later, she realized that my cutlery is very small actually. Huh? And then I asked her like, how much haldi to put? And she was like, put 1/4 or just a pinch of haldi. But I like half spoon haldi, not 1/4 spoon, half spoon haldi. Absolutely okay. There is no harmful effect, no documented effect by any research. So you can put, and in every product, whenever I cook food, I will put more turmeric. So Koel is asking a good question. So Mira will answer this. Mira is a yoga trainer. So now, okay, I will answer this. Just a kidding. Um, uh, you might have seen, Koel might have seen some Instagram reel to say this, that turmeric causes heat in your body, or someone who wants to prevent you from eating turmeric. It doesn't cause. And turmeric also does not cause jaundice also. Um, You should listen to your mom, then Koel. Yeah. Yeah. Even sometimes moms are wrong, you should listen to your mom. Garlic is protective for liver as well as heart, all your arteries. So one now, how do you eat garlic? So any preparation, whatever you do, there is one more preparation today I will tell you. So peel off your garlic, one or two cloves, keep it for 1 hour, and by the time, but when you are having your meal, start with garlic. You can chop it and put it in your salad also. Initially, you may not like the taste. Now, why I want you to keep it for 1 hour or 2 hours outside? Because there is some chemical which is going to get converted when it comes in contact with the air. So you peel it, keep it, and then eat it. That benefit is there for heart, arteries, and liver. Ginger, my most favorite product. So ginger tea, don't buy ready-made ginger tea. They have very little ginger or dry ginger. So dry ginger, everything is gone there. Oxidation, everything is gone. Yeah. So you want to have a fresh ginger, peel it, cut it, put it in the water. So bring the water to boil and try to, the objective is to boil it as long as the water becomes half. So when the water is half of its original, that is the time you are ready to drink ginger water. If you like, you can put Jira Vella, you can do Kerala, or you can add the lemon and honey in that. Personally, I like the plain ginger water. If you want to reduce your sweet cravings, I will ask one question. So if you want to reduce your sweet craving in ginger water, what will you add? Write down in your answer. A cinnamon in ginger water. Okay, you can try. I have not tried it. Honey will not decrease your sweet craving. Lemon, good answer. Think big. Lemon is here. Yeah, there is something here top. Which is that top product which reduces your sweet craving? Very good, Akshara. Shirisha. Okay, everyone has come now. ACV, apple cider vinegar. So apple cider vinegar reduces your sweet craving immediately because it will flatten your fall. Yeah, it will also decrease your sugar spike. So apple cider vinegar. This vinegar you put in noodles is a different. Huh? And there are some fools who drink apple cider vinegar with the spoon. No, there is a correct way to it. Take 1 spoon of apple cider vinegar, put it in glass full of water. Yeah, you have to dilute it because it's so acidic, it will burn your esophagus and pharynx. You don't want to take that risk. And after that, after drinking it, you have to rinse your mouth. Otherwise, it will dissolve your enamels and it will cause yellowish of teeth. Apple cider vinegar is my favorite to reduce sweet cravings and for a lean body. Yeah. Apple cider vinegar with mother, without mother. It doesn't matter with mother, without mother, if you are looking for the benefit of sweet cravings. But apple cider vinegar with mother, if you are looking for benefit for stomach, intestine, right? Because this with mother means it has some particles of apple and it has bacteria, it has probiotic. So with mother, apple cider vinegar is good. How do you select apple cider vinegar? Good versus bad quality. The bad quality will be packed in plastic bottle. The good will be packed in glass bottle. The bad will be, the low quality will look transparent. This will look little muddy, dirty. The low quality will have no or minimum sediments. This will have more coagulates. That is the mother. So you want apple cider vinegar with mother, which is a good brand, which I have tested multiple brands and tried and found out. Borges, Borges. Yeah. So you can try that. Ginger, cinnamon water. Very good. Very good, Gayatri. Now, all those things we'll say about green tea and all, don't tell your client to shift from your normal tea to green tea. and it is protective actually, but green tea is more protective. But if you cannot drink green tea, if you cannot afford green tea, yeah, so you can have better things, apple cider vinegar and all, and not everyone likes the green tea. Okay, so you ask the client whether you like green tea, whether you can make it, whether you can drink it. Yeah, don't be like me where you say, okay, you cannot afford milk, then put protein powder in the water and drink. But protein powder is more important. Yeah. So I was like that when I was an intern. You will not do that unless you are earning money out of it. Now, very controversial topic. I'm coming, a delicate topic, avocado. Yeah, all those hippies, vegans, psychos, you like avocados? It is very costly. Taste is very disgusting. Normal human beings, we don't like. Okay. And avocado, what to make, I don't know. No one knows what dish to make. Yeah, you cut and put it or you eat it like some paste. What is it? Stupid. Yeah. There are better things than that. And then there is a very fancy thing, 1,000, 1,500 rupees per liter, avocado oil. What should I do? I should cook my food. I need 250 ml of oil every day. What should I do with that oil? Sprinkle it on my body or head? What should I do? Yeah. So don't tell your client something which you cannot afford. Yeah. Even if client affords. Taste is very hideous, disgusting. Olive oil. Okay, that's good enough. Now in olive oil, there are three components. So you have pomace oil, which you can use for your Indian cooking. Yeah. Fry and deep fry, all those things. Hey, but can you afford that? Yeah. So your normal oil will be 160 rupees per liter, and this will be 500, 600 rupees per liter, even if you buy a big quantity. Yeah, pomace oil. Taste is hideous. Then you have virgin oil. Yeah, that you cannot cook it, you cannot warm it. Then there is extra virgin oil, which means it is not processed at all, but it has been purified. So personally, I like extra virgin oil. And again, that should be packed in glass bottle, not in plastic bottle. How do you drink this extra virgin olive oil? You can put it in salad, either fruits, salad, or anything. Yeah. You can drink it with spoon also directly, 1 spoon daily. Taste is not so good unless you develop it, but it has healing property. It helps develop your ciliaris and villi in the intestine. It is protective for liver and skin also. As soon as I say skin, all the girls start drinking olive oil from tomorrow, whole bottle. Yeah. What is the coil? BOR, what is it? Coil? So coil probably is talking of some boric acid or something. Coil, please, English. Legumes, obviously, Borges. Yeah. You will find it on Big Basket. Yeah. I have distributor for sheep, distributorship for that. So if you buy it, obviously I will earn money out of it. But if you want to give me money, I prefer checks, cash, and gold. Yeah. And if you want to give gold, give something like 100 gram or above, because so that's my style. And this aspiration you should keep for yourself, that how much you want to earn. You want to earn that much that I want to give my husband, means your husband. You want to give your husband the same gift like Dr. Mittal sir wears. Yeah. You should have that aspiration. How many of you have that aspiration to give a gift to your loved one, either a parent, child, or you know, husband or wife? The kind of things I wear. Write in the chat. Those who write, say I, me, will be able to do. Those who don't write, they are like, poor. Dominos. Housewives. Very good. Very good. I like you. Those who are writing me. Yeah, I should like me also. I still want to give to my second wife. Yeah. Hmm. Plus sides, girlfriends. No, I don't have girlfriends as of now. I have only one. I'm so disappointed in my life. Yeah. Probiotic, my favorite. Any probiotic you take, But don't buy commercial probiotics because they have nothing but lactobacillus acidophilus. That's just a marketing tactic you're falling for. You're paying 20 rupees, 100 rupees for one small bottle that has no content except lactobacillus acidophilus that you will find in your curd. Okay. And don't fall victim of yogurt and curd. What is the differentiation? I could still do not know scientific differentiation between yogurt and curd. I think it is a marketing tactic to sell it for something more costly. What is the content? I'm talking of probiotic. Yeah. Both have lactobacillus acidophilus. Yeah. This curd has natural lactobacillus acidophilus grown in milk. And this yogurt has lactobacillus acidophilus grown in milk coagulate. Hey, what is better then? Your homemade curd is better, right? Then there is more probiotic, all Indian pickles, foreign pickles, kimchi, kafir, Russian something. Doesn't matter so much. Whatever you can afford, you take it. If you can afford, you must buy Actico Pro, which is my brand. So after 2 years of research and investment of 25 lakhs, I have developed Actico Pro, which contains different bacteria, different yeast combination, microbial flora, which combination is presently not available in the market, and it provides growth. This bacteria is orodispersible, so it will dissolve from your mouth, will prevent bad breath. It will line up your esophagus, intestine, mouth as well, reduces diabetes. It lines up your intestine, all microbial or cilias and villi. It goes to the grooves. It prevents entry of inflammatory products, and antigens. It prevents entry of harmful bacteria. Either you are going through stress, you have fever, taking antibiotic, you must take probiotic. But the best part of this Actico Pro is it has microbial flora which releases dopamine, which secretes serotonin. What is the biggest source of serotonin in body? Intestine. So it is secreted by this microbial flora, which is there in Actico Pro. And this goes to brain, gets converted to dopamine. And it causes, it makes you happy. It releases your depression and anxiety. One of the best product for detoxification. Do not forget water. Drink plenty of water, around 3 to 8 liters, 6 liters, as much as depending on your activities and all those things. Yeah. What is your water consumption? Write down in the chat. How many liters you drink per day? So water is very good for your intestine, for your body overall, for your brain, for your skin, for you, everything. Yeah. And as soon as you get up in the morning, you are dehydrated not in your body only, but also in brain. Yeah, you feel little foggy, you feel drowsy. As soon as you get up, before you rise up, drink half liter, 200 ml of water. Your brain will open up. Yeah. If you don't like drinking water much, you can add something in it. You can make ginger water, you can make jeera vellam, you can put lemon, do something, but drink water. Yeah. The most important, the most critical factor for preventing fatty liver is smile. If you smile, fatty liver is gone. And if you attend the classes with video on, you will never ever have fatty liver. You can treat many patients with fatty liver. Today I have some guest at home, so we need to close it now. They are waiting since half hour, and I'm giving them promotion kind of thing. They are sitting directly in front of me. Okay, and watching me like, कब खत्म करेंगे सर करो ठीक है so we'll meet next Sunday. Continue to attend this Sunday classes, don't miss. Okay, tsunami comes, flood comes, earthquake comes, attend this Sunday class. I really have this meeting, then I have to catch flight, but still I decided to continue today's class. Okay, bye, have a great time.